Alright, so in this video series, we're going to talk about shock. So we're going to look at what shock is. We're going to look at how to recognize shock and the different types of shock. So let's start with a case study. So EMTs Tess and Steph are responding to a report of chest pain, along with the crew from Engine 9. Their general impression of a man is in his 50s who is sitting in a recliner, hand on chest, and in apparent distress. He is pale and extremely sweaty. The EMTs confirm a chief complaint of chest pain and continue their assessment as they begin their treatment. Tess is immediately concerned with a weak and rapid pulse and labored respirations. So what information do you get from this information? So you have a man in his 50s sitting back in a recliner, hand on chest, in apparent distress. He's pale and sweaty. So just right off there, people usually are not pale and sweaty for no apparent reason. So obviously there's an underlying cause. He's complaining of chest pain, so that's of concern. And we have a weak, rapid radial pulse and labored respirations. So think about from a few sessions ago and looking at perfusion and what do we need for perfusion and what happens when perfusion is not there. So, and look at the other components of that must be necessary for adequate perfusion to exist is an adequate pump. So we need adequate cardiac output, we need adequate heart rate, and if we have a problem with either of those, then we're going to have problems with perfusion. So, if we have a problem with perfusion, then we have a problem with the exchange of oxygen and carbon dioxide and waste particles from our cells. And this is part of the series we're going to look at is what is shock. So shock is, the medical term for shock is hypoperfusion. So hypo means less than normal, hypoperfusion. So we know what perfusion is, so we have low perfusion status. So shock is nothing more than low perfusion. And we always really limit and relate shock to low blood pressure, which is a major factor, is low blood pressure causes low perfusion states. Because if we don't have adequate blood pressure, we can't get the oxygen to the cells that's in need. So the body attempts to restore homeostasis, and remember homeostasis is a state that our body likes to be in. Our body likes to be normal, and if we're not normal, then our body shows signs and or symptoms of we're trying to correct that. So our body's constantly in that the balance of what's normal, what's not. So and our body's really good at managing that, but in some cases our body's trying to compensate, but the compensatory factors are just too overwhelmed and our body cannot compensate. So if we look at the case study and looking back, what significance of the weak rapid pulse and labored respirations? So what is the significance there? The weak rapid pulse and labored respirations. So think back about perfusion. What do we need? We need an adequate stroke volume. We need adequate heart rate because that's our cardiac output. So if we have increased heart rate and a weak pulse, tells us our blood pressure is probably low. And if our blood pressure is probably low, then we probably are having a state of poor perfusion. And because normally our heart rate isn't elevated. So our heart rate gets elevated for a couple reasons. One, it's trying to maintain an adequate blood pressure. Two, for stimulation from our sympathetic nervous system. And examples like that. So, or we're trying to pump more oxygen to our cells. And in this case, we could probably think that may be the case, especially when you're saying we have labored respirations. So labored respirations tells us that our bodies need more oxygen. For whatever reason, we're not getting it. Our body needs more oxygen. Our heart is pumping more, trying to get the oxygen that we do have to the cells that need it. So then it's just a kind of revolving cycle that's hard to break without interventions. So what should EMTs do to manage this patient? So the EMTs on scene, according to case study, have started their treatment. So what's our treatment regimen? So if you think back, he's pale, cool, pale and diaphoretic, he's sweaty, he's complaining of chest pain. So if he's complaining of chest pain, he's clutching his chest, so obviously we're probably going to have to intervene and help with the chest pain. So, but how are we going to do that? And is his blood pressure satisfactory enough for us to give him anything for his chest pain? So those are all factors we have to combine. We got to put these together, develop a field diagnosis, think about the other possibilities. We're going to rule out some other possibilities it could be, and try to come down with what we think is going on with them and treat accordingly. So some of that is just treating the symptoms, some of it's actually treating the condition. If you treat the condition, you treat the symptoms. So shock, as we mentioned, is defined as inadequate tissue perfusion or hypoperfusion. And with that too, we also have waste buildup. So if our cells are lacking the oxygen that's needed, and maybe they're lacking oxygen needed for multiple factors that are associated with it, but if our cells do not receive the oxygen that's needed, then think back about before in anatomy, what happens is if we have poor perfusion, we have poor exchange with oxygen, carbon dioxide, and waste. So when that happens, our cells are now going from aerobic to anaerobic metabolism. We lose cellular energy that's required for cellular metabolism. So if we're unable to meet all the goals of our cells, then we're going to have those adverse effects of being anaerobic metabolism, poor ATP production. We're going to have problems with sodium potassium pump. We're going to have problems with communication within the cells. We're going to have problems with our cells moving and functioning normally as they should, not to mention we have the waste buildup. So in some forms of shock, such as sepsis, and we'll talk about that later, so if our body's in a state of shock from some type of infection, and we can't get the cell's waste product away, then our body starts having more adverse effects. So if our sodium potassium pump fails, then our tissue starts to die. Our tissue, who makes up the group of tissues, make up the organs. So if the tissues start dying, then the organ starts dying. And then that leads again to a cascading effect. So treatment of shock is aimed at restoring perfusion to provide cells with glucose and oxygen, because that's what we need. So we're going to try to shift this patient back from anaerobic metabolism to aerobic metabolism, get them the supply of energy they need with glucose, allow the cells to function properly and regain the power and the energy it needs through proper ATP, restore the sodium potassium pump, etc. So that's where we're going to look at, and that's where we'll stop this first video, is looking at what was shock. So again, shock is a state of hypoperfusion or low perfusion. When low perfusion persists, then the cells of the body are not getting the oxygen that it needs. That leads to anaerobic metabolism. Anaerobic metabolism leads to poor cellular function. It leads to excessive waste buildup. It leads to improper sodium potassium pump, and then it's just a cascading effect if interventions are not began. And even with that, though, some patients who are in shock are in extreme shock, and sometimes, regardless of what we do, it's not enough. So we'll continue this, and we'll look at some other forms of specifics of shock later, and we'll look at how a shock occurs.